Hello everyone. Today we are going to learn about the topic is Pap Smear. I am Minoli, tutor of Triple M College of Nursing. Let's see what are the objectives we are going to discuss in this session. Introduction about the Pap Smear and purpose of the Pap Smear and screening frequency and time of doing a Pap Smear test and when to stop routine screening and equipment for Pap Smear and preparation before the procedure and during the procedure and post of procedure and to give the health education and coming to the conclusion. What is Pap smear? Is obtaining a sample exfoliated cell which is called dead cells that are shed of cervix and simple test to look at cervical cells, which is also called papnicola or cervical cytology. The specimen should be obtained 2 weeks after the first day of LMP, last menstrual period, should be taken by brushing or scraping method should be done. And what is the purpose of we are doing a pap smear test? So first one is to detect the early cancer of the cervix and to determine estrogen activity related to menopause or endocrine abnormalities in the body, and human papilloma virus HPV virus to detections like certain strains of HPV can lead to cervical cancer, and to monitor any other abnormalities if prior of pap test helps to monitor progress. What is the correct time of doing the pap smear test? Usually the people starts within the 3 years of onset of sexual activity or by age of 21 years considers every 5 years should do the pap smear test. And if the people is having a high risk factors for cervical dysplasia or early onset of sexual activity, and the person who is having a multiple sexual partners, and if the person is having a smoking habits for prolonged period, and oral contraceptive pills, those who are using like oral and other type of contraceptive pills is like vaginal contraceptives using, so they can go for the pap smear test. And HPV and HIV positive women can go for a pap smear test. And weakened immune systems which is due to organ transplant and chemotherapy or chronic corticosteroid usages. Frequently we can go for a screening test. So yearly until 3 consecutive normal pap smears, then may decrease the frequency to every 2 to 3 years once. And annual screening for high risk women is highly recommended. When to stop routine screening? If people is considered as age 70 and adequate recent screening if they have done, they can stop the screening test. And 3 consecutive negative pap smear is considered as negative, they can stop routine screening test. And if no abnormal pap smears in the last 10 years of the test is report sayings, they can stop the screening test. And if the person is having hysterectomy for benign lesions, they cannot go for the screening test. Equipments for pap smear test. The first thing is a vulva sweeping set and vaginal speculum, savlon, torchlight, and perianal draper, and IS spatula, and a cyto brush, and thin prep, and mask and sterile gloves is need, and KY jelly, and swab sticks for HVS, and specimen form and container. Before the preparation, the nurse should advise a patient to make an appointment other than during the menstruation period. So, before appointment, avoid intercourse and touching or using vaginal medications for 2 days before the test, and refrain from touching for 1 day. And in case the use of vaginal medications for at least 48 hours before it. And then pre-procedure care. First, we have to inform and explain the procedure to the patient and advise the patient to avoid the bladder empty and provide the privacy and assist the position like lithotomy position and to have the examination table and tape the patient's permit with the minimal exposures area, not to expose the over the body. And during the procedure, Explain the procedure as needed, encourage the patient to take deep breaths and help the pelvic muscles should be relaxed, and give support to the patient and assist the doctor in doing the pap smear, and helps to open the pap smear sets, and help to focus the torchlight to pineal area to focusing, and then during the procedure undress completely or only from the waist down, and lie down on your back on the exam table with the knees bent lithotomy positions, and heel rest in supports called strips, and insert the speculums into the vagina. The speculum holds the walls of the vagina apart so doctor can easily see the cervix, and take a sample of your cervical cells using a soft brush, and a flat scraping device called a scapula can be used. And after the post procedure care, observe any discharge from the vagina, perineal care as needed, and assist the patient from the dorsal recumbent lithotomy position to supine position. And finally, to do the documentation and send the specimen to laboratory with a form. And post procedure care to check the normal, normal in case negative means there is no identifiable infections, and ASUS means the presence of high risk infections with HPV, human papilloma virus, and low grade changes frequently due to infections with HPV virus, and which in some instance can be risk for the cervical cancer, and high grade changes very atypical cells that may result in cancer, and squamous cells carcinoma or adenocarcinoma, which leads cancer is evident and requires immediate attention. And what are the health education can be give to the patients for the after the procedure? So tell the patient to inform any excessive bleeding after the procedure, and a little bit bleeding is normal, and instruct the patient to follow up the procedure at least annually or biannually, so it depends on the results. I hope you all understand about the pap smear test, and thanks for watching. Keep subscribe our channel.